Hey everyone, welcome back. And I'm going to continue my pharmacology series with anticoagulants. So we are going to talk about heparin and warfarin. And I just want to add one thing here that anticoagulants does not dissolve the existing clots, but it stop new one from forming. So let's talk about heparin and warfarin together. So like look at a little difference. So heparin, we have to give it through IV or sub injection, but warfarin, we can give it through pills. Heparin is pretty much faster than warfarin. So heparin takes few days to work, but warfarin takes days to weeks. So what they do, they combine these two therapies together. So by the time warfarin gonna work, because it takes days to week, and then by the time heparin will do its job, and we cannot give heparin for a longer time, so then we're gonna stop heparin, and when warfarin kick in, we're gonna rely on warfarin and continue the warfarin therapy because we can give warfarin for years. Like patient can stay on warfarin for so many years. So just to easily remember, heparin is short term for only for a few days. Warfarin is long term for a few months or lifetime as well. So labs for heparin, we have to look at PTT, and warfarin it's PT/INR. How I usually remember PTT, like how computer people they have HTTP, like for web address. So H heparin PTT for the lab. So HTTP heparin PTT, and warfarin it's PT/INR, if it makes sense. So if we talk about antidotes for warfarin, it was always easy for me to remember, which is vitamin K. But for heparin, how I usually remember heparin, so protamine sulfate, so pro kind of. I don't know if it makes sense, but this is how I usually remember. So protamine sulfate is for heparin, vitamin K is for warfarin. The other thing which is very important to remember is heparin can not cross placenta. So we can give heparin safely in pregnancy, but warfarin has Xbox warning by FDA. So it can easily pass the placenta, it cross the placenta. So we cannot give warfarin during pregnancy. So heparin is safe for pregnant people, but warfarin is not safe in pregnancy. So heparin is like tranquilizer. It works so fast, but it also wears off so fast. On the other hand, warfarin is like antidepressants. That was my analogy, that it takes too long to work, but we can use it for a longer time. The other nursing priority is we need to watch for bleeding. For whoever patient is taking these anticoagulants, we also need to teach them to watch for bleeding. They need to use a soft toothbrush. They need to use electric razors and not the traditional blades for shaving. And we need to watch for blood in stool or urine. So these are the major nursing priorities for the people who are taking anticoagulants. Okay, so this is all for anticoagulants. See you later in next video with new drug. Bye.